Let's see it. There we go. All right, all right, all right, all right. I am so excited. I'm so excited. I'm so excited. We finally got that one little thing fixed with the sound. And man, I can't even tell you guys how excited I am about this particular broadcast because it has to deal with men's health. And on tonight, what I really want to talk about is why are men so afraid to visit their doctors? And why do they wait so long to go? Why do we procrastinate like that? What is it about it? And so on tonight, I have my frat brother, Dr. Rod, and his beautiful wife, Dr. Tina, on. And I'll let them tell you who they are, let them introduce themselves. But I can tell you this much. They are a wonderful couple. And I've had a chance to speak with both of them. But me and Dr. Tina had a chance to talk last week. And it was a fantastic talk. She taught me so much. And there's one thing, Dr. Tina, I really want to harp on, but I'm not going to talk about it right now. But it's the advocacy part and asking questions because a lot of us don't do that. But let me just do this. Let me turn it over to you guys and let you introduce yourselves properly. And let's get into this.
All right. Well, thank you. Like I said, I'm Tina Robinson. This is my husband, Rod. We've been together for 36 years, met in medical school. So we did our medical training at the University of Alabama School of Medicine in Birmingham, and then I did my internal medicine training at the University Health Science Center in Memphis, in the University of Tennessee. And that's where Rod did his training in pediatrics. And from there, I started a practice in general primary care, and Rod did a fellowship in neonatology. We currently live in the south side of Atlanta, and I've been practicing internal medicine here for about 20 years. So primary care physician, managing chronic conditions like diabetes and hypertension, cardiovascular health, large focus on preventative care, and also, management of chronic conditions.
Yes, 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 yes. So that's those two areas I really want to talk about: hypertension, diabetes, all of those things, colon cancer, pancreas, just all of those different things that affect men in particular. But I really want to focus on Black men because we are the ones who are really kind of victims to this. And it's a lot has to do with us, right? And us not visiting the doctor, and for a plethora of reasons. And so, Dr. Rod, I'm glad you're on with us, but I want to talk to Dr. Tina first about this because you see a lot of male patients, as you and I talked about. Yes. And one of the biggest reasons I wanted to do this tonight, because a friend of mine who is suffering with diabetes, he knew he was pre-diabetic, then he had moved over into having full-blown diabetes, and he still kind of just managed the situation really poorly. He didn't change anything, in fact, didn't change how he ate, didn't change some of his habits, still smoked cigars on a regular basis, probably twice a day. He still drank with the cigars, didn't change, again, his eating habits. And he had gone in for a routine visit just 2 weeks ago. He just thought he was going in because he had an issue with his foot. So he went in for a visit, wound up having an emergency surgery to remove a toe. Mm. And while at the doctors, they told him, look, we're going to remove this toe, but we don't know yet how bad the infection is. And depending upon how bad this infection is, we may have to take a second toe, a third toe, maybe your foot, maybe your leg. We aren't certain, but we know we got to remove this toe. And so I was talking to my wife today, and she just told me he had the first toe amputated. And then now he's scheduled for surgery to have the second toe amputated tomorrow. And so it's really done something to me. I've actually shared his story with other men because it didn't have to happen. And so, Dr. Tina, I want to talk to you, about this issue with us as men, in particular, Black men. What are you seeing? And what is it about us specifically? Why won't we go see the doctor? Why do we wait until after we get a diagnosis like this, and then now a toe is gone, we're all of a sudden concerned? So I'll turn it over to you, and you talk to us about it.
Yeah, I mean, that's a really sad story. And, we're always hoping that your friend does well and they get the infection under control. But, Michael, I think there's a lot of barriers that men have, particularly Black men, as far as health-seeking behaviors. Like why aren't they seeking the health care? And it goes from, distrust of the medical system, be it actual or perceived. As we all know, our perception is our reality. So some people just don't think that healthcare is going to deliver for them, or they're going to be treated differently. I think a lot of it comes from our past experiences. Were you a child who went for preventative care? As did your parents take you, or did you only show up when things got really sick? When you got really sick, those those cultural differences make a big difference in if men will go in and seek preventative care.
Excuse me.
And then I think another thing is just it's not always apathy. I think that's something that a lot of people may contribute. And then that lived experience of Black men, it's not always apathy. It's my experience. It's oftentimes they just don't know. I
Mhm.
think if someone like your friend had any idea that a sore on his toe could lead to gangrene, which is now leading to limb amputation, um, I think everybody wants to live their best and healthiest life. So I think it behooves us to talk about education and the value of prevention. And, I think a lot of times it's that self-seeking behavior, and also on us as healthcare providers, making sure we're educating and explaining to people what a hemoglobin A1C is. Do you know your numbers? What are the things that's going to put your cardiovascular system at risk? And again, that's the whole crux of bringing everybody in to see primary care. We all know that Black men disproportionately suffer from health outcomes.
Mhm.
And I think sometimes it may be that sense of, well, that's, it's not for me. It's a trust issue, Michael. It really comes down to, building a trust relationship with a provider that's going to help you live your best and happiest life.
Yeah, we talked about it a little bit, and I'm glad you said that because I think I told you and talking to you, you were the first doctor that, like primary care physician, I really felt comfortable with because of your approach, and I think that's a lot. That has a lot to do with how, especially men, come in because we're already nervous about the procedure itself. Because what we always think about is a rectal examination, right? And
Yeah.
so a lot of men, when they think about a rectal examination, they kind of think, well, that makes me less of a man to have this. Like this is what I've heard, right? And I'm like, well, don't you want to live? Because if they catch it in time, if something is there and it's caught in time, they can remove these, remove whatever might be there and help you live a little bit longer. As opposed to now you constipated, you can't, you just can't do anything. And when you finally go, they tell you you're a stage 4 because of something that could have been prevented some time ago. What are like these excuses that you're hearing, and like how do you help them overcome like just being at ease? I know what you did with me when we talked, but and I'm just gonna say this to the audience so they know this about you. She is a very good communicator. She asks a lot of questions and make you feel. I wish you were here, honestly,
No.
because I would come see you. I would change, and if I'm in Atlanta, I may have to just change up my schedule and try to fly down and see you because you just made it so easy for me. And one of the things I realized too about you, and it really hit me, hit right here. I've never had a woman doctor, a primary care physician, a dentist, anything. And in talking to you, I realized I think that may be it. Like just that caring side. And no disrespect to you, Rod, or anything, but I just think a woman sometimes is a little bit more caring or just a little softer touch. But I'll let you talk about that more. And then Rod, I'd like for you to speak to that as well, too, please.
Yeah, I think, and this has been shown in some survey studies out there that Black men in particular are very sensitive to that trusting relationship.
Mm-hmm.
They absolutely value that, that they feel like the provider listens and cares about them. And I use a term with people that I talk about shared decision making. Okay,
Yes.
you
Mm-hmm.
know, it has to be shared, and I think as providers, be it a woman, a man, whatever race or ethnicity you are, as a doctor, we need to understand that Black men have this conception, this fear, if you will, about genital urinary exams. And you do not have to have a rectal exam. It is you consent to that.
Mhm.
It, it may seem not necessarily logical, or, oh, it's not a big deal to me, but it can be a very big deal to you or to another person.
Mhm.
And it's a sense of masculinity. It's a sense of control. It goes all back to that whole, the male body, the black body, right? It's invasive. It feels degrading. And so, if that is your reason, if you really peel back the layers and say, that's the reason I'm not going to the doctor, because I don't want to be probed. I don't want to be a patient. I don't want to be, treated in that form, that dehumanization, then you've got to stop yourself and say, wait a minute, why? Because a bad experience is a barrier that leads to less exposure to the healthcare system, which leads to poorer outcomes. So that's why I think that if that's your thing, if that's your reason, pick the doctor that looks the way you want. Some people, don't like me because I'm pretty Southern and I talk in a lot of real simple language. But I've not met anyone so far. I've been at this, like I said, over 20 years, that can't understand blood flow to extremities and how that could affect your limb if you're diabetic, for example, or why you need a preventative exam, or why would I care about your prostate? Why would I care about your blood pressure? You feel fine, but your blood pressure is 150 over 85. That's not okay. And it's up to me to explain that to somebody. Now, they may not be ready to hear me. I mean, I feel a primary care physician's role is consultant, right? I'm paid by you to give you my best information of what I think you should do for yourself. But we have to also listen as much as we talk. What is important to you? What outcomes are you looking for? And some people are ready to go right in and lose 30 pounds and do everything. And some people, they're not there. And that's okay. It's about building that relationship, because for me, my patients, it's a longitudinal relationship. It's years.
Mm-hmm. Yeah.
Well,
Okay.
I mean, for me, like I said, I let them do the talking. My specialty is newborn intensive care, so I'm not really the person you're going to see as an adult. I don't do adult medicine, but I have been a black male for 60 years, so I'm a little qualified to talk on that. So I think it's, even for me, just my personal experience and people I talk to, friends and frat brothers and all those sort of people, and just acquaintances, it's even before that. It's even not getting to the door where you can talk to the doctor, because we always have an excuse. Well, let me do some things first before I go. Let me see, can I drop a little weight before I go? Let me clean up my diet before I go. Forget about the rectal exam. That's a whole nother barrier or fear or misconception. And even now, like she said, we don't even have to have a rectal exam. We get the labs drawn. So that should not be a barrier. But a lot of people don't know that. And then other people are still doing it. Physicians are still doing it when they don't necessarily need or have to. So I think that we have to figure out a way to prioritize ourselves so we can be here for our family and friends and loved ones, and not be so afraid of what might happen. I think if you don't know you have something, it's almost better than if you knew. I know that sounds crazy.
No, it doesn't. It doesn't.
If I don't go to the doctor, I can't have diabetes. If I don't go get my blood pressure checked, I can't have hypertension. Yes. Now, my kidneys may be getting worse and worse and worse, but as long as if I haven't got that label, I don't have it, so I'm good. When actually I'm not good.
Yes. No, that's a very common scenario.
And that's just as a male kind of do. And I've done that myself. Like, let me put off my physical for a couple of months and get, lose a couple pounds. I put back on and knowing full well, if I go to the doctor, he's going to tell me, you put on 5-10 pounds. You need to get that weight off.
Yeah.
So we kind of kick the can down the road.
Yeah, we do. And it's crazy that we do that. But that point you just made, Rod, like thinking that, well, if I don't go, I can't have it. I can't be sick. I can't have cancer. I can't, whatever the case is, if I don't go. Well, that's crazy to think that, because when you get there, you may or may not have it. But if you do, maybe something can be done to overturn it. And I'm thinking about Dr. Tina, the conversation we had, and it was striking to me. I don't know why I never thought about this, but as a civilian going to see a doctor, I've never really thought to question a doctor, like really question a doctor about my health, about alternatives, about whatever the case might be. I've always thought and been under understanding if your doctor tells you this, it's pretty much gospel. But it was so refreshing to talk to you to say, hey, no, we're in this together. And part of the doctor's job as a consultant is to try to help you understand your condition and what could be done. And in some instances, it's always a slow burn, but there's still some things that you can still do, even though you're trying to get yourself under control. And so I want to just talk about that a little bit, because the education, like doctors just taking the time, because we're civilians, we don't know all the terms, and just being patient with us to understand, hey, I need to explain this to them so that when they leave here, they aren't even more intimidated, they aren't even more fearful, but they'll start to take their health a little bit more seriously. And then we can work together to put a plan in place to get you on a healthier track.
Yeah. So I think, this whole doctor-patient relationship, right?
Mm-hmm.
It's a relationship. And if you, the patient, the person is deciding, it's time for me to go in and get a checkup or go see a doctor, the best thing you can do to get that visit to go the way you need it to go is to think about it beforehand. What do you want out of that visit? Do you want information? Do you want them to drive the visit? You tell me, doc. I've heard that, doc, I'm 60 years old. Tell me what I need. Tell me what I need to know. Or do you have specific things? And, there's nothing that's, at least for primary care, there's really nothing off the table. I'm worried about myself. I'm worried about what happened to my family or my father, my mother. How can I avoid that? My brother just, got on a dialysis center and is looking for a transplant. You hear that. So if you can just say up front, and sometimes it's best to write down, a couple bullet points, put them on your phone, pull it out and say, what brings you in the office today? Well, I'm here for a checkup and I'd like to cover these 3 or 4 things. That helps me tremendously to kind of know where you are, right? Mm-hmm. What you're expecting out of the visit. And then I can tailor it to that, because I think some people leave the doctor's office, Michael, and they don't feel like they got what they came for.
Yep.
And, it's our job to be perceptive, and it's our job to, cover the necessary bases. But doctors are not mind readers. So I think go in and just ask. If they don't feel like you've answered the question fully, then, do a follow-up question.
Mm-hmm.
Well, just because your brother had dialysis is not a problem for you. Well, are you going to check my kidneys? What can I do to help keep my kidneys healthy? Lean in a little, just lean in a little,
Mm-hmm.
And so I think that, knowing what you want before you get there helps a lot.
Mm-hmm.
And then just start the visit that way, and then if the visit's going sideways, I mean, we all know we have relationships with people all the time. When you're connecting with someone and when you're not. And if this person doesn't seem like they're listening, it's absolutely okay to say, it seems like you're not listening. Think about my situation. I have a patient who comes in, they've got 2 guns cocked. I mean, they are mad. And I just met them. And I'm like, and you can tell something's really going on under there. And it can't be mad at me because they just got there. So I'll just say, seems like you're really upset today. Sometimes all you can just call it out, right? Let's talk about it. And if they want to talk about it, they can. If they don't, that's fine too, right? So, I think being prepared, being open, being honest, and then doing your job is listening. Some people say, like Rod said, you need to lose 20 pounds. We've all heard that, right? Some people are not ready to hear that. That hurts their feelings. They're not ready to hear that. Okay. We don't have to talk about that today. Let's talk about something else. But, we'll get back to that. And sometimes, if it's something scary, you may have to just focus in on that. So, there's all different kind of visits. And I don't think it's a one and done kind of thing. People go, well, I went for my checkup. Okay, that's fine. Like you take your car in for the 100,000 mile checkup. That's great. But if it's making a knock or a ping and you're like, I don't think this sounds right, this is not driving right, I don't feel right, you need to go back.
Yeah. So this is good because we talked about this a little bit as well. We're talking about now interviewing our doctors, right?
Yes.
And I don't know of anyone I've ever talked to, and again, it's the first time I'm talking to you, I never even thought to interview my doctor. It was simply, and this is how most Black people that I know of that go to doctors, there's a list they may get from whoever their healthcare provider is. That person's in your area, or sometimes you'll get a referral from someone. But even having done that, gotten a referral, there's still no part, there's nothing to interview. You just go. And whatever care you get, you get. And that, when you told me that, that like a light bulb just went off. Like, wait a minute. If I was having a house built, I'm not just going to take a builder, just this first builder I get to, and be like, okay, I'll just go with that builder. I want to know more about it. I need to know more about this person. What's your skill set? You know, what do you do? How long have you done it? Let's talk about that, because you told me about, I think there's a tool that you can use that you can interview a doctor to make sure that, hey, this person is going to be a great fit for me as well, because I'm the one who needs to care.
Right. And, you know, and I'm a big fan of the CDC, not just because we're in Atlanta, but cdc.gov has some good tools in there about, you know, how to prepare for your visit, and to, you know, kind of what kind of questions to ask. So that would be a great resource to look at for something like that. And, you know, unfortunately, though, I do think most people, and I bet your listeners are the same, they've probably fired a doctor before. By that, I mean, they never went back.
Yep.
I won't see that person again. Mm-hmm. Now, that's fine. So they have interviewed a doctor and they said, nope, not that person. But you know what ends up happening, Michael, is that that's where it stops. And that's not where it stops. If that person doesn't work well for you, you go get somebody else. You're back to your house analogy. You're not going to finish this house with no floors. Mm-hmm. If this flooring person doesn't work for you, you're going to find another flooring person, because you got to have a floor. Exactly. And I feel like you got to have an internist. You got to have a primary care doctor.
Yeah. That's so.
Now we're getting into access, and that's a big barrier.
Yeah, that's a huge barrier for us. This issue of prostate cancer, this issue of blood pressure, especially blood pressure. Can we talk about this for a minute? Because I was telling you, I had gone in and I had gotten an exam, and it was 140/80. And my doctor said, man, your blood pressure is sky high. Now, I was telling you that I also have a holistic doctor that I also see. And this was a good balance. So my primary care physician is a man. My holistic doctor is a woman. And she literally said to me, that's not necessarily the case. And then she said to me, how are you feeling today? This is literally what she said. She said, how are you feeling today? I said, well, I think I'm feeling pretty good. She said, no. How do you feel about this visit? Like, were you nervous coming here about what I might say to you? And I said, what do you mean? She said, you know, Michael, there's a condition that people have. I forget what it's called, Dr. Tina, but it's a fear of actually going in to see a doctor. So your blood pressure elevates because you're, I guess, all these thoughts about what could be wrong, as opposed to just having an open mind and be like, okay, let me just hear what they have to say. And she said,
coat syndrome.
What is it called?
White coat syndrome.
White coat syndrome. And I bet you a lot of people have white coat syndrome, especially men. And because I have never asked one of my white friends, but I know a lot of Black men who have this, right? And she was like, let me get you settled. Let me not do this right now. Let me get you settled, then take your blood pressure. So she did it 2 or 3 times. She was like, no. She's like, it's down. You were probably a little nervous about this visit. You were probably running different scenarios through your head. It's not that bad. But she said, it is a little high. It's higher than it probably should be. And we have to deal with it. So I asked her, I said, well, how do we deal with it? And she asked me, how do you want to deal with it? I said, what do you mean? She's like, well, you can deal with this a number of ways. We can change your diet. You can start exercising. You know, you do all these other things. But we're going to have to put you on synthetic medication immediately, right? And I said, well, no, I want to go that route. She said, well, let's do this first. And if it doesn't improve, we'll take these incremental steps to get you where you need to be. I didn't get that from my other doctor. It was just, hey, you know, and I wondered, Dr. Tina, because I know a lot of Black men suffer from high blood pressure, especially 50 plus year olds, right? Maybe probably even 40 plus year olds. And I just wondered, did he kind of look at me and be like, this is the average Black guy? He probably has high blood pressure. I don't know, but I just wonder after talking to her because it was such a different experience. Even talking to you, I got more of the experience I got with her than I did with him.
Well, are we biased? Everybody has bias. Being human, there's a bias there.
Mm-hmm.
We all, as internists, we know 1 in 3 out of us are going to be on blood pressure medications.
Mm-hmm.
It's just the facts, it's good, bad, indifferent. It just is.
Mm-hmm.
But are medications in and of themselves bad? No. Are they and so are they a marker of failure? No.
Mm-hmm.
Right. So I think a couple things is that, you explain what normal blood pressure is, and normal blood pressure is 120/70, in case anybody wonders. And that doesn't matter if you're black, white, young, old. 120/70 is what a normal person's blood pressure should be, or
Okay.
lower.
Mm-hmm.
So if it's over that, it's elevated. Now, that's not that my blood pressure is always this. How many times have I heard that? Okay. But this is you're human, underneath this layer of epidermis, Michael, we're human.
Yep.
And this is what we are. And this is what our cardiovascular system looks like. So 120/70. And then the other thing I tell people is that checking your blood pressure in the office setting is not the best way to manage blood pressure. It's not linked to the best cardiovascular outcomes. The best cardiovascular outcomes come from home blood pressure monitoring. And so, that's a big thing for me, is just making sure my patients have a validated blood pressure cuff. They know how to check their blood pressure. They know how to average those numbers, because if you check your blood pressure 3 times in a row, you're going to get 3 different values. That can be maddening to people, right? Just
yes,
it's imprecise. It's imprecise. No, you're alive. You're a living being, and it changes minute to minute. It changes day to day based on all these variables. But educating how to do that, how to manage it, and then if it's high, for example, what if your kidneys absorb salt when it's supposed to let it go through? And it's just the way your kidneys are acting. That's not about you. You're a bad person. You did something wrong. So if I need to give you a drug that's going to make those kidneys work like they're supposed to work,
mm-hmm.
like God designed them to work,
Mm-hmm.
and that makes you normal, then that's what you need. And so I obviously I write a lot of prescriptions for a living. I don't practice just holistic lifestyle medicine, but I think I do both. I think you have to talk about the things that we do that leads to these cardiovascular events. I think we all have to recognize the skin we're in, what our family history looks like.
Mm-hmm.
And then we have to own that. And then we have to decide, what do we need to get ourselves back to to lower the risk the best we can and live our best life.
Now, since we're talking about blood pressure, and guys, folks that are on, feel free to ask questions. But since we're talking about high blood pressure, because that's really big for men. In fact, I know a lot of men die from high blood pressure. Yeah. What can we do better? I know we need to exercise. I know we need to change our diets. But I'm wondering, Dr. Tina, and also Dr. Rafa, you as well, you could probably answer this. I know you're not a primary care physician, but what can we do? Because I know there are a lot of pressures outside of like just your body, just like the pressures of just work, the pressures, as Dr. Tina, of just being a black man, the pressures of just life in general. Yes. Sometimes that gets to you. It has nothing to do with how bad you eat or how well you eat, or if you're in great shape or not, but just pressure of life, your job, your kids, your marriage, your money. And you start thinking about all these things, like that's a real thing. And yes, that could cause you to have and walk around all day with high blood pressure. But I would love to hear what you think about that. How do we deal with this better?
Yeah. What you're asking is, how do you thrive, in the world you're in? And I think that's a very important question. I talk to people a lot about mindfulness, understanding it. You can control minute to minute your pulse and your blood pressure just by changing the way you think and the way you respond to stress. And I think too many of us I didn't say this, I read this somewhere, but that we lead our lives in pretty much an unconscious state. You just get up every day, you go to work, you just keep grinding and grinding. We keep hitting our head against this brick wall. We get a bloody head, and then we're not happy. We're not living our fullest life. So I think for all of us, we need to stop and realize, where can you find that level of self-awareness, mindfulness that makes you happier. And if you're in a situation that's not good for you, having courage. It takes a lot of courage to change anything. Well, this is the way my grandmother made, food. So this is how I'm going to make it. But educating yourselves, being open to trying something new. Maybe you feel like you may get some flack from your family or your spouse if you say, we want to try something different. Being curious is always important. I think we should I think adulthood is lifelong learning, right? So like Rod and I have done like a vegan challenge for a few months, or we did a no sugar for 30 days. That didn't go so well. We try to do dry Januaries, no alcohol in January, we try to exercise differently, and just constantly trying to bring new things, new ideas to the table. But the things to understand is that all of us need 64 ounces of water every day. All of us need at least 150 minutes of cardio a week. All of us need diets that have less than 4 grams of sodium per day. And there's so many apps out there and tools. It's pretty easy to find that information. We all need to limit our alcohol. Men should have no more than 14 drinks a week. Women should have no more than 7. I mean, this isn't kind of rocket science stuff.
Not in the same night. Not 14 in the same night.
A week.
Yeah.
And so, and there's a lot of research out there about all these high-tech MRIs and all these, expensive medications. But if we just went back to the basics and just tried to live the way our bodies were built to live, fruits and vegetables, right? I always joke with my patients. I'm like, well, what is that food? Can you tell what kind of plant that came from? Because by the time it turned into a Pop-Tart, who knows what it's gone through, right? Doesn't look like anything, that our grandparents would have eaten.
Right.
So I think it's a big difference.
But you also have to I think we have to make life a little simpler. We look at some of our elders who also lived to be long, very old, and they didn't exercise. They didn't have gyms, but they didn't have social media. They didn't have 24-hour television.
Right.
The screens were cut off at midnight and they came on at 6 a.m. And I think, and I'm preaching to myself as well, we have to figure out a way to simplify what we do and how we live. And sometimes we don't need an extravagant meal. Our elders didn't have that kind of money. They just ate at home. Now, granted, they didn't always cook the right way, but then they ate stuff out of the garden or from the farmer's market, and you ate what you had. And so I think that's a big part to kind of dumb down and simplify life. We can go back to the blood pressure part. You can go to CVS and check your blood pressure, to the grocery store and check your blood pressure. But I can tell you that first time, and I've done this, you sit down at that chair, that first blood pressure is a little high, because when you walked in, you're like, oh my God. Now you got to sit there all stressed out trying to see if it'll go down.
Yeah.
But there's just so many ways and so many resources. It's so easy to go get a blood pressure cuff. We have a cuff. We have 2 or 3 cuffs here at home. But just get one of those and check your blood pressure periodically. And you just never know, you might be fine, and that's good. And hopefully everybody will be. But if it's a little high, that's when you need to start saying, okay, I got to do something. Not when you hopefully in front of a physician saying, hey, this is your blood pressure sky high, like you were saying.
So let's go back, because this is good now. Let's go back for a second. First question. What kind of approved cuff should we have? Because that's important too, because we shouldn't just run out here and get like the cheapest, maybe not the most expensive, but we need to know, is it a particular brand? Is it a particular model? What are we looking for in this cuff?
Good question. So what I tell my patients is that they want an upper arm cuff, unless their arm circumference is more than 20 inches. And that's a pretty big arm. Okay. See, the size of your cuff really matters. I tell my patients, if you spend more than $50 on a blood pressure cuff, you're probably getting taken. Thank God for Amazon, right? There's a lot of cuffs out there. There's some good companies. Omron, Omron, sells some really well validated cuffs. You want a cuff that has battery powered. You sit in a chair with your back, feet on the floor, arm on the table. I tell people to check their blood pressure first thing in the morning. Go to the bathroom, but before coffee, before pills, before food. You're supposed to sit there for 5 minutes, and relax. Who sits still for 5 minutes? Then you check your blood pressure. You check your blood pressure. You check your blood pressure. You should do it 3 times in a row, just back to back to back, because it's that average that really matters. Your home blood pressure should average less than 135/85. If they're over that, then you probably need to seek care and ask, and I love those visits when people come in and say, Doc, I've been checking my blood pressure and my blood pressures are running up at home and I'm concerned about that. That just opens the door so easily for me to step in and say, well, let's talk about your lifestyle. Let's talk about your stress. Let's talk about your sleep. Don't mitigate the blessings of a good night's sleep. There's so much obstructive sleep apnea out there. Again, if your partner says, hey, you're snoring, hey, wake up, you stop breathing, that could be an indication that you've got untreated sleep apnea, which affects our cognition, affects our cardiovascular health. And maybe the only way it's showing up is just high blood pressure and you feel exhausted. That's a very treatable condition.
Okay. So this is really good. So we know Omron is the brand. We should check it 3 times in a row. This is something important because I've never done this. I've never had my blood pressure taken with my feet flat on the floor. I'm normally sitting up on a table.
Dangling.
Yeah, yes. No. And I'm wondering now, could this have added to my blood, could one way or the other? I mean, just these little things like this is the reason I really want to have you on, because first of all, your voice is so calming. And then just your demeanor, just knowing this and you saying, okay, let's do this the right way. And just starting those conversations to help us to ease into what could be down the road, something traumatic. But at the moment, it's just easing into, whatever the thing is. So we got that. Anything 135, you said 135/85?
Right. That's what the average should be. And, it's like anything, Michael. I think all of us, we need to make our decisions based off of facts and not fear. Mm-hmm. It just is. Check your blood pressure. You may say, well, it's high and they're going to put me on a drug. It's going to cause bad things. I know somebody who took that lisinopril and it hurt them, or I know somebody who took a drug and it caused erectile dysfunction. That's fears talking. Don't let people stand in your way like that. I mean, if you let people talk about what childbirth feels like, none of us would ever have had kids, right?
No.
That's pretty funny.
I tell people all the time, water has side effects. So if you drink water, too much water, you can have a side effect. But you should drink water, don't get me wrong. So, it is what it is. You can't be fear-based is the bottom line.
Right. I mean, it's just be matter of fact about it. And if you're not ready to talk about it, then educate yourself. Like I said, the CDC's got great websites. American Heart Association has great information out there, and get credible sources, right? We all make fun about Dr. Google, right? You Google your symptoms, up to and including death.
Yeah.
I mean, come on.
No, that's pretty funny. But to that point, to both of you guys' point, don't make your decisions based on fear.
Right.
And can I just tell you, I know a lot of men, Dr. Tina, we talked about this, who will not take blood pressure medicine. Number one reason, ED. So I really want to whenever we get into a space I really want to talk about, because I know a lot of men have a lot of pride. And they're like,
yes,
not going to happen. So take your time here, please. And let's talk about this, because not just blood pressure medication, but I'm sure there's some others, but specifically blood pressure medication.
Yeah.
Can you talk about that? Because I want people to get beyond the fear and then what else can be done. Because a lot of men don't realize you don't need Viagra. This issue could be taken care of so many other different ways.
Yes.
And so could you just talk about that? And not taking your blood pressure medication is not the answer, because you don't want to have ED.
Right. And, again, you meet somebody in the office, you don't know that they're having that problem.
Mm-hmm.
So I think the first thing, any of us who are prescribing meds or treating somebody with cardiovascular events need to talk about sexual function. We need to take a sexual history. I mean, sex is a part of living. It's normal for all of us, right? And so we have to be able to talk about everything. And, I make a joke to my patients. I'm like, the two people who need to know the truth, there's probably more, but the two that's got to know the truth is me and your attorney. So you got to tell me, if you're having sex outside your marriage, if you're having erectile dysfunction, if, whatever. No judgment. It's just about, this is how I'm going to help you take care of yourself. And then secondly, I think that, it's important to understand that side effects can happen to any of us, right? Mm-hmm. And that if you're experiencing erectile dysfunction, you got to talk about it. ED itself is the number one indicator of underlying cardiovascular disease. Think about that. People take blood pressure medicine and then they get ED. Anybody ever thought about why they're having that? Okay. It's because they have underlying cardiovascular disease is why.
So break that down. I didn't mean to interrupt, but please break that down, because right. I understood exactly what you just said. You're having a problem with blood getting into your heart and blood circulating, period, through your body. Most people don't realize that if you're having ED, that's a larger problem. Like, the ED is a small problem, no pun intended, but that's a small problem compared to what's going on inside. So please talk about that, because that's the larger issue.
It's an indicator of of blood flow, right? What is an erection? It's just blood flow through the veins into the penis. That's what it is. Mm-hmm. Your friend who had the toe problem, he was having circulatory problems down there. But I'll bet you $1 he's not down there checking his pulses in his feet. But if he's having ED, he recognizes that, because it's just common. It's going to be very obvious, right? Mm-hmm. So it's just a very common indicator of cardiovascular function. So again, not to scare men who are having that problem, but to say, hey, this is another issue, right? It's kind of like you tell people, if you're having chest pain or shortness of breath when you're trying to run up the flight of stairs, that could be a problem. That could be an issue. So bring it in and let's talk about it. As far as what can be done about it, I'm old enough to remember the years before Viagra and Cialis, Levitra. So there's a lot of tools in our box. I started practicing internal medicine before there were things like ACE inhibitors and some of the newer calcium channel blockers, which are so much better tolerated than the old-timey beta blockers and some of the drugs that caused a lot of men a lot of heartache. And then, just the facts of life, Michael, some men do have erectile dysfunction, and it's going to impact their ability to be sexually active when they're older, 65 to 85. And I've had a couple of men who's told me, like, Doc, if I knew that was all I was going to get, I'd have had a lot more sex early on in life. What was I saving myself for? But, and then there's surgical things, there's non-medical treatments, there's lots of things. And I will speak to you as a woman, as a wife, sex is not all just about one thing. It's the larger aspect, and I'll bet you $1 your wife would tell you the same thing.
Yeah. No, that's good. That's good. I just want men to realize that if that happens, like, you got to take care of your heart. Like, if that goes, the rest of life you can just forget about everything else, right? And I don't think men realize how important that is, because they're thinking about what's down there as opposed to what's right here. And the blood not flowing. Like, I've known people, Dr. Tina and Dr. Rod, they literally went into the doctor, had their blood pressure checked. Next thing they was rushed into surgery because their heart was blocked. Like, they had 2 valves or 3 valves. They having this open heart surgery. They're like, what are you talking about? I'm feeling fine. It's like, whether you're feeling fine or not, we're telling you right now, you got arteries blocked. If we don't do something now, you ain't walking out of here. Matter of fact, they're going to carry you out of here. Yeah. And so I just want men to know that, because I don't think they realize that that's more of an issue.
Well, that's
So,
the sobering statistic, right?
mhm,
And we all know that Black men have the highest mortality when it comes to cardiovascular disease.
mhm,
And that's what's really unfortunate, and
mhm,
that we have to get past that. There are many things we can do to improve that, but health seeking behaviors from you, the Black men that are listening, and then also the empathy, the trust building, the shared decision making from me, the primary care physicians out there. I think it's a partnership, and Black men deserve health. I always tell people that, you deserve, as no dialysis on my watch, no, things like that. But because I say you deserve to live the healthiest life you can. Not all of us are going to make it to 85, and that's okay, right? But you deserve to have the best health you can.
yeah, that's that's something. And then there was something that also stuck with me that you said that there's even a responsibility of the spouse here.
Yes.
And I never thought about that. My wife is very supportive in pretty much everything I do. And I thought about what you said because I know a lot of men whose wives they aren't they aren't as encouraging or supportive, especially when you think about having ED, which I think a lot of men stress over
Mhm.
because of that. Right? They're just like, I already got all this other stuff going on, but I know now I got to deal with her and this and that, and that. So could you talk about, because this was really a good piece I thought we talked about. I never thought about it until you mentioned it,
Yeah.
the spouse's responsibility in your health and your wellness.
Well, like I said, this has been published that Black men who have strong female influences in their life, wives, girlfriends, sisters,
Right.
mothers, aunts, actually have better health outcomes, and because of that. But I think it goes back to having people who love you. If you
Hmm.
have people who love you, right, as opposed to people who don't really love you, they're not going to have your best interest at heart. And, another thing that's difficult for all of us, men and women, is difficult to accept what we can't change, right?
Yeah.
And if something happened to your sex life, it's hard for women too. Trust me, I've many times had couples come in and the wife is upset because of the loss of her sex life with her husband, just as much as he's upset about it. So, we all can grieve the losses of things we can't have
Yeah.
or may not have, but you know, it's going to happen. Some of the wives are going to get mastectomies. Does that mean she's not as much
Hmm.
of a woman? You can't love her the same. I mean, I think most of us would say no, that's wrong. So similarly, it's a loss, and we have to talk about that loss, and we have to process it. And everybody processes different. Rod and I've been married for 36 years, but we're not the same person.
No, none of us are.
No.
Yeah. Man, this has been so.
Stop suffering in
I
silence
like
too.
that.
We, especially as Black men, we suffer in silence a lot, right? I mean, we feel like we don't have anybody to talk to. Sometimes it feels like we're getting it from all angles, even our own folk, if you will.
Mhm.
But we have to figure out a way to not suffer in silence, and help each other. We go to church, be it church, community, fraternity, friends, whatever the case may be. We have to figure out a way to help each other.
Yeah, I'm glad you touched on that, Rod. That's a big deal because you got to figure most men, and I think Rod, you and I talked about this a little bit. Most men don't even talk to their friends about their health. Like they
Mhm.
don't talk about like if they had some major injury or some chronic illness or disease. They aren't talking about it. They're
Mhm.
really just kind of suffering in silence and just going about their everyday life. When we know that when you can openly share with somebody and they can, be affirming and caring, it can help you get through pretty much anything. I've heard people say the reason I made it was because I had this person or these people or this community of persons to talk to and help me. Like when I think about cancer patients or recovering alcoholics, I'm just like, it's amazing to hear how they part of their recovery were these other people and just being able to have somebody share with. Yeah,
It's true.
just just great. So, Dr. Tina, I don't want to keep you. It's the time is getting late, but what I want to ask you now is, and I know you can help with this. How do we get these men to get to the hospital, to get to have regular visits with you? How do we get them to get over this fear of just, going to the doctor, any doctor, I don't care who they are, what they look like, just going to the doctor in general? How do we do that? What do you recommend to us? How can we be helpful? Like, what is it? What do we do?
So I think that every man that we all know and care about, we ask, we just communicate. Do you go to the doctor? Have you thought about going for a checkup this year? I know COVID has got everybody kind of not going in, but it's time. And then secondly, empowering people to say it's okay to go in with a list of questions or things that I'm not ready for. Like, I don't really want to talk about colonoscopies and prostate exams today. Okay. You're paying for the visit. You say it. Think about access. I think that's another key thing about, getting care. The Affordable Care Act has allowed a lot of people to buy health insurance, but just recognize a lot of people don't have access to good health care. So asking, there's clinics around, there's places to get care. But I think, again, that goes back to that. We didn't even touch on it, but that whole pride thing about money and resources, right? I'm not going to say that I can't afford to come in or I can't afford my medicines. And sometimes as doctors, I just have to ask, do you have any problems affording it? And that the relief on their faces to say, I can't afford that right now. Okay. Well, then let's talk about what we can do. Right. So, I think humbling yourself, putting yourself first, communicating, asking people that you care about, and like you're doing tonight, Michael, just spreading that topic around and letting people know it's okay to talk about, things, go to see a primary care physician somewhere. And if that person doesn't give you the service you deserve, just like you wouldn't buy a car from somebody you don't like, you're not going to take healthcare advice from somebody you don't like. Pick another one.
Yeah.
Because it's about you. It's not about the doctor. It's about you.
Exactly. Rod, do you want to chime in on that, Dr. Rod?
I mean, I agree with everything she just said. I mean, it's just a matter of getting out there, getting what you need. Don't be afraid. I mean, unfortunately, only about 5%, about 3% of the doctors in the United States are African American, and only about males, and only I think about 5% of females are African American. So we have to figure out a way. A lot of us like to maybe go to our own folks for our health care. We also have to just think in terms of, I just have to take care of myself. And it involves me getting to the right person. It could be a person of different ethnicity. Like you're saying, it may be a female versus a male. And just get beyond the whole, the whole facade of worrying about whether or not, it's a male. I gotta, I gotta say what's wrong with me that's making me weak. It's not making you weak. You're going to be stronger because you're going to be alive and hopefully vibrant and not be disabled, and you're going to be there for your family. I think we have to think beyond just the whole visit part, if you will, and what that means.
No, great. I wanted to hear from you because, of course, you're a male, so I want to hear from you about that as well. But Dr. Tina, I was going to let you go, but you said something, and two things came to my mind. You mentioned colonoscopy. I can't even tell you how many men will not go get a colonoscopy. This to me is crazy because I got my first one at 50, right? And when I told guys, I said, I even put up a post. It was the best sleep I've ever gotten in my entire life. And let me just tell you, I thought I'd been asleep for 10 hours. They was like, no, Mr. Jones, it's been 15 minutes. I was like, you gotta be kidding me. Dr. Tina, I almost offered them some money for whatever it is they gave me.
That was Michael. I always said, that was Michael Jackson drug. It's horrible to say that.
Awful.
But you're right, Mike. I mean, I did the same thing. I mean, the prep is the prep. Yes. Okay. You're stuck at home. Please don't think you're going to leave your house because you will not.
No.
I don't care what your best intentions are. You will not.
No.
But as far as the actual procedure, it's painless.
It's painless.
It's over before you know it's even started.
Absolutely.
So please, people, go get your colonoscopy. Hopefully you won't have to go back for 10 years like most of us. But please go get it. I mean, it's so not much of anything.
At all. Like it was, I heard people say, well, it's invasive. I was like, how do you know if you're asleep? I was like, it's not what you like. You got to just put these things out of your mind. Like, don't go in with a mind full of fear, like you said earlier, Dr. Tina and Dr. Rob. Don't go in with a mind full of fear. Just go in with an open mind to figure out what's going on and get it taken care of. But the colon, I'm like, man, are you serious? 60 years old, you've not had one colon, not one? Are you kidding me? Not one at all? And it's such a small thing that could save your life. And the one thing I want to get out of this is, and the reason I brought you on here was because when I think about legacy and when I think about my family, I think we do ourselves as Black men a disservice to our families by not taking care of ourselves. We cheat them,
Yes.
right? Your grandkids will never know their grandfather because you were afraid to get a colonoscopy. You didn't take care of your feet. You didn't make sure that you took your diabetes medication. You just didn't do a whole host of things as it relates to your health. So your kids get short-sighted or get slighted because their dad left 10 years earlier than it had to be. And I thought about that, and I was just like, man, we could just do so much better. How much richer could our community be if these persons had just taken care of themselves, because they'd be here with us to pass on all these or create these memories, pass on all of these different things, but they aren't here because they just didn't take good care of themselves. So
And remember, one little plug for colon cancer screening. If you're 45 years or older, you're at risk. The number of colon cancers is going up in our country, not down. So now everybody 45 years and over, man or woman, any color or creed, it doesn't matter. If you're a first generation immigrant, it doesn't matter. Or if you've lived here, since the Massachusetts colony days, you need a colonoscopy. And hopefully we'll try to make it easier to get people access to that. They can be pricey. A lot of plans now cover those. It's not the only way to do it. You can do the non-invasive fecal occult blood test. We've all seen the little Cologuard commercials. That counts. That helps. So I always tell people, do something. And the right test, Michael, is the one you'll do. So do the non-invasive.
Say that again. Say that one more time, please.
The right test for the patient is the one the patient will do for you. So do colon cancer screening. Don't let that sneak up on you. And I don't have to give you any other examples of how many lives have been lost way too soon. There's no signs or symptoms of that. It's an absolutely curable cancer if you can catch it in the early stages.
Yep.
So,
and that's exactly the point I was making. Last thing I thought about as you were talking, mental health. Now I know you're not a psychiatrist, but you can still speak to this because it's health-wise, right? And how your mental health impacts your physical health. Yes. And I remember when I went to the doctor and she was talking about a holistic doctor, she was saying to me, hey, you got to be careful about even your job. Your job has so much stress related to it. And this is about mental health. She said, and now it's starting to look like it's taking a toll on your body because you're just not taking good care of yourself. So could you just speak to us about how important mental health? We're hearing a lot more about it now with athletes. It's a lot more acceptable to talk about now. And again, I know you're not a psychiatrist, but I know you can speak to it. Could you just talk to us a little bit about this? And I promise I'm going to let you go.
Thank you. So, interestingly, most people with mental health issues, and we're talking about mood disorders, right? We're talking about anxiety and depression. We're not talking so much about schizophrenia or bipolar disorder or, those real scary things. Because those people, God bless them, they present early enough in life that there's, it's pretty obvious. But mood disorders, very common. Almost everybody has some mood disturbance in their lifetime. Most people do go to their primary care doctor first. They don't go straight to a therapist or a psychiatrist. There's a lot of good self-help tools out there because you could say, well, what am I experiencing? What's going on with me? The Calm app is out there. The My Strength app is out there. There's a lot of good self-help tools to help you kind of get a sense of where you are. And they do give you some feedback about you probably need to do some self-based cognitive behavioral therapy, right? That gratitude, relaxation, that kind of thing. Exercise is so key for mood disorders. People run like jackrabbits on spinning wheels. They don't get enough sleep. They don't take care of themselves. They don't take a day off. You've got to take care of your body. Your body is not a machine. It can't just run 24/7. It has to have some downtime. And then if you find that you are up against the wall and it's impairing your ability to do your best at work and at home, listen to the people who love you because they see it. They can tell you when you're not doing okay. Then go seek some help for that. And absolutely, primary care is a wonderful place to start. And never forget this: if you have suicidal ideations,
Mm.
think about your time is just it's not worth it here. One of the most common things people will say is they think that the people around them will be better off without them there.
Wow.
And that is absolutely that distorted thinking, because suicide just blows a hole in everybody that loves you. Suicidal prevention hotlines don't negate that, right? Um, and then I will just also say that I treat suicidal ideations. Again, that's another taboo thing, right? But I tell people that's like a fever. If you have a fever of 103, you're sick and you need to get some help. If you're
Mm.
having thoughts of ending your life, you're sick and you need some help.
That was so good. Whew. That was really good. Dr. Rod, would you like to add to that, sir? You look like you had something to say.
No. I was just thinking the same thing. I mean, you just have to get out there. Don't be too proud to say I need help. There's so many. I guess I was thinking about all the different things and resources that are there. You know, if you're have an exercise app, they usually include meditation, mental well-being things. In addition, yoga, whatever the case may be, just do something. You know, like I said, put the social media down. I know I'm bad about it myself. Can't put my phone down. I know that. But just try to take time for yourself. Get outside, get some fresh air, just a little thing. You don't have to run 5 miles 3 days a week or 3 miles 5 days a week to get benefits. You can just walk. You can just get out and just talk to someone. Just talk about the ball game or something that's relaxing. But we have to be careful because, like you were saying, with your business and all the different things you do, and I do the same thing. We can be so caught up in life, we don't even realize we're stressed.
Yep.
We're so used to doing it day after day after day after day,
Mm-hmm.
and sometimes you just need to just step back and reset. And I think that's for me, that's what I was thinking. Yeah, I have this thing right here, this little wrong finger, I guess. But this thing right here, that's just it tells me everything. How I sleep, if I've got enough rest, if I'm exercising, how many just this one little ring. And I have a Apple Watch too. But I mean, it's just so many different things, or Android watch. I'm not trying to plug a certain thing, Fitbits, whatever you want to call it. There's just so many options out there for you to kind of do some little things to take care of yourself, and that's huge. And not just, and even from a mental health standpoint.
And then I would just like to say one more thing.
Sure.
And don't let anybody else define what success is for you. Yeah. Okay. You know, TV is not the real world.
Or social media.
Our social media, that's not the real world. If you're happy and you're well adjusted and you make $30,000 a year, that's a definition of a successful life. Right. It is not, don't let anybody define what happiness and success is for you. And, you know, not just because we're interracial, we learned that early on from a race standpoint, but it has to do with so many things. So many people are trying to keep up with these completely unrealistic expectations that are external. They're not internal drivers. So if it's not something that internally drives you, if you feel like your life is driving you and you're not driving your life, something's out of balance there. And you got to just take stock and figure out where that is. Yeah. We've all had hard years. We've all had hard times. Sometimes you just have to suck it up and get in there. But it's that chronic stress, I think, what you're talking about.
It is. It is. Listen, I don't want to keep you guys any longer. This has been wonderful. Like, thank you so much. I really appreciate you both, Dr. Rod, Dr. Tina. This has been a great discussion. And I'm just hoping that men walk away from this and they say, let me at least go to the doctor in the next 1 or 2 days, later this week, something. And I hope that if you're watching this, that if you care about any man in your life and you know they have not gone to the doctor, they have not been to the dentist, they have not been to optometrist, they haven't been to whoever or whomever, encourage them to go. Go with them. Do whatever you have to do so that they will go, so their life might be stretched just a little bit longer. Their families might have you a little longer. I'm talking to men now. That your families might have you a little bit longer. It's nothing like having the man there, and that just doesn't discount the woman, but having the man in the household. And it's preventable, a lot of these different things. And, you know, guys, we have to be better with asking our friends and being more responsible to them and all these kinds of things, because we could live so much better lives if we just did that and not be so embarrassed or afraid about whatever the condition might be. Dr. Rod, I'm sorry, I saw you.
And just do something simple, everybody. Just ask them, are you okay? We ask each other that all the time, you know, every day almost. How are you doing? Are you okay? You'd be surprised because they may not be okay. Or, you know, if they don't look okay, are you sure? And just a simple question. That's
a great way to end this. Just ask the question, are you okay? And I guess ask yourself too, really, am I okay? Am I really okay? Because we know when we really aren't, but we got to do this. Again, thank you guys so much. I really appreciate you coming on and talking to us and educating us. This was it was just so unbelievable to me. And I hope it was to all of you who are watching. Please take action. Don't let this fall on deaf ears. Do something. Ask the question, are you okay? This is Mike Johnson for Mandatory Conversation. It's been a great conversation. We'll be back on next week. We're going to touch on men's health care and talk about men taking care of health for the rest of the month. So next week, we'll have someone else as well. So please join us. We'll have some more doctors on all the way through the end of the month. It's been a pleasure again. Guys, thank you so much. And I'll follow up with you in just a minute. Have a good evening. Have a blessed evening, and we'll talk to you soon. This is Mike Johnson. I'm out of here.